Look, there's Carl's brain.
Where? I don't see it. Is it behind that walnut on a stick?
Yeah, that's a tiny brain. So that begs the question, is there a correlation between brain size and intelligence? Actually, there is a correlation between brain size and intelligence. Another thing that helps determine intelligence is the gray matter. How thick is that gray matter layer and how convoluted or wrinkly is it? So the more wrinkly, actually, usually the more intelligent you are. Not 100%, but there is that direct correlation. And I don't want to stir up any controversy, but men usually have bigger brains. So are we smarter? Well, women usually have a thicker cortex. I'll let you be the judge. I'm not going to touch that one. So the stick, what was that? That was most likely his spinal cord. Now, what connects the brain to the spinal cord? That's going to be the brainstem. So the brainstem has 3 different parts. The most important one is the medulla oblongata. Why is this? It controls your heart rate, your heart rhythm, and your breathing. That's pretty important, don't you think?
Good morning, class. Good morning, Miss Pancreas. Miss Pancreas? Yes, Bladder? Can I go to the bathroom? You'll have to wait till after roll call.
Yes, Bladder. All right, so here you see about 5 or 6 students, i.e. glands. What is a gland? What does it do? Why do we need it? Well, what a gland does is it secretes a substance, hormones, sweat, milk. So what does a gland do? Well, a gland helps to coordinate a lot of different functions in the body. So for instance, metabolism, growth and development. It also helps regulate our sleep-wake cycle. It helps with our sexual development. So glands are extremely important. So let's take another look at this clip.
Good morning, class. Good morning, Miss Pancreas. Miss Pancreas?
All right, so there.
Yes, Bladder?
So obviously she calls him out by bladder, so we know that this is the urinary bladder. So he's got to do what? He's got to pee. So what does a bladder do? Well, obviously a bladder is going to hold urine. But how much urine does it hold? Usually, on average, it'll hold about 300 to 500 cc's. So 500 cc's, that's about half a liter. And then your bladder sends a signal to your brain, it's time to pee. In actuality, the bladder can hold quite a bit of urine. And when it's time to pee, you need to get up and go pee. Because if you hold your urine chronically over a long period of time, and I'm talking about years, sometimes the bladder is not going to be effective, and sometimes it's not going to be able to squeeze out all the urine that's in the bladder. Now, in practice, I've seen a bladder hold well over 1,000 cc's of urine. This is not healthy. This is definitely pathological. So if you have to go to the restroom, go ahead and urinate. You don't want to chronically hold your pee. What happens is the bladder can become weakened, you can become incontinent, and when it does come time to urinate, you're not going to expel all the urine out of your bladder. That can be a problem. We're talking about possible urinary tract infections.
Hey, that's not a bad idea. Ow!
Angelica, what happened?
What are you gonna do?
I'm gonna take pictures of your insides. Say cheese!
That's a pretty intense apparatus there. Now, x-rays, they did kind of come into prominence back in the late 1800s, and some of the contraptions, they were pretty monstrous, but this is probably a little bit over the top. So if you see, this guy's got these gloves on. So what are these gloves? Well, these are lead gloves. And if you notice, she doesn't have any lead protection. She doesn't have a lead apron or anything like that on. Aren't patients covered with some kind of lead protection? They used to be up until 2021. So now the recommendations are that this is no longer recommended because it provides no benefit. So things have definitely changed in this regard. All right, so we see she's trying to get attention. Obviously, she's falling down the steps. She's doing this for gain, right? So what is this called? Is this Munchausen? So nowadays, the term factitious disorder is a little bit more commonly used, and this is a mental disorder. So what causes this, or what makes people more prone to having this? Well, there are some theories out there. Some are that abuse, neglect, or if someone has had repeated hospitalizations throughout their lifetime, that can make them more prone to having this. Also, if somebody believes that they may have been abandoned by somebody else, whether it was the death of a loved one, a mother or father, this can make them more prone to having this factitious disorder. This is very difficult to treat. Why is that? Well, if you have factitious disorder, you're doing this for a specific gain. and you don't want to lose that. So you'll do anything to not be found out, including lying through your teeth.
Someone's coming!
Hello, Mr. Postman.
Look at his face!
Can't touch it!
Well, he looks bad, right?
I've seen this before.
Where?
There.
What are these spots? Well, it's kind of hard to tell just from a cartoon, but they're either one of three things. It's going to be either a macula, a papule, or a vesicle. Worst case scenario would probably be a vesicle. So a vesicle is going to be a fluid-filled sac that basically sits on the epidermis or the outer layer of the skin. So what is in this sac? Well, most likely is going to be basically a vat of virus. So what is the differential diagnosis? What does this kid have? Could have a number of different things. Obviously what pops up, chickenpox, measles, those are probably going to be the two most likely. When you have spots like this all over your body, it could be a number of different things. You could even have this from an allergic reaction to medications. Other things that could cause this would be fungal infection, bacterial infection, but chances are, if I had to guess, he's got the chickenpox. So the chickenpox, what is it? What's the name of the virus? We all know this, varicella zoster virus. This is what causes the chickenpox. This is also what causes shingles. So varicella zoster, once you get infected and have chickenpox, it lies dormant in your spinal column and it can reactivate. So what can cause reactivation of this varicella zoster virus? Physiological stress usually. So if you have an infection, if you are out in the sun and get overheated, those are just a couple of the things that can cause reactivation of the varicella zoster virus. So when it reactivates, this can cause the shingles. So if you have the shingles and you expose someone who's not been vaccinated for the chickenpox, they can get full-blown chickenpox from this.